You are listening to the Movement Therapy Podcast.
Alrighty everyone, hello and welcome back to another episode of the Movement Therapy Podcast. Thanks for tuning in again. I'm joined here today with some very special guests, Luke and Liam, two of our exercise physiologists in our clinic. Today we're just going to be talking a bit about what an EP does, how they've become an EP, and how they treat in the clinic. So thanks for joining us, guys.
Thanks, boys, taking time out on your Friday afternoon to join us. It's an in-house session today.
It is.
It's good. We're all wearing the MT shirts. It's fun. It's good. It's good stuff.
So to start us off, guys, it'd be an open question. Why did you both want to become an EP, or did you not, and you've just ended up here? Is that?
It's a last resort.
Well, for me personally, I just enjoyed obviously sport growing up, like most people would, and I'm like at school, I'm gonna do something around that. So I started sport and exercise science, which when you start the degree, you think like you're gonna work with pro athletes and everything. You're like, this is the perfect job, and you kind of realize. Well, I kind of realized I'm like, it's probably not for me anyway, and then. I actually learned at uni you could go to exercise physiology. So I kind of knew about it, but I didn't know much about it. And through being at university, I was like, oh, it actually sounds really interesting. And during that time, I was kind of working in a gym setting as well. And I was finding like people with like little niggles, aches and pains. And I was like just curious about like figuring it out. So it kind of led me to that. And it kind of was a no-brainer for me because I'm like, I love exercise. I love solving problems. And it kind of worked well. Like, there's problems with people with injuries or health conditions that an exercise physiologist could treat. So for me, it kind of was like just a natural progression out of school into uni. And then, I never really looked back since. That's how I kind of got into it. And now I love it. Wouldn't even change.
So good.
If anyone asked me to, but yeah.
Obviously working at the best clinic as well. So
best clinic obviously helps as well. So
good team.
Yeah. It's a great job. So I don't know if I have to sell the job or anything in this podcast, but
we'll do a little plug at the end.
Yeah, if you want to become an exercise physiologist, it's a good job. It's a good job.
That's so good. How'd you get into it then?
I think similar in the sense of like sport at school. Probably everyone thinks they're going to be an athlete, and then when they're not, they try to do a job in it.
The fallback
to
from
some
the
degree. Yeah, this is my plan B. But I was doing exercise science and rehab at Wollongong Uni, and I was probably halfway through the degree before I realised it was an exercise physiology degree. It just wasn't communicated to me. Maybe.
We'll get into that.
It probably was, but I probably wasn't listening.
It's just during your party era.
Maybe. So no. Then once I realised what exercise physiology was, because I'd never heard of it when I was younger or at high school. And then I sort of learned the differences between it to say physio, which is probably what I originally thought I was going to do. And then decided to finish off the fourth year, and then found I really enjoyed the placements, and then I was happy to stay with that. And then I think it's a question you always get asked, like, are you going to go do physio
It's always that natural progression from uni, isn't it?
But I kind of, I don't feel the need at all to, and I'd sort of say it's like if you did like plumbing, you wouldn't go then and become an electrician.
Yeah, exactly.
Like they're sort of
it's a completely different track.
Yeah, so
awesome.
I kind of just fell into it, but then really happy where I ended up with what I'm into and the people I work with. So.
That's great. So just an overview, Liam, how far out of uni are you?
This is my third year.
Third year? Yeah. Luke?
Can
you remember?
This is one of the questions I'm assuming before we start. I think 5 years maybe.
And where did you start before? PT first?
So while I was doing sport and exercise science, I did personal training. So I've probably been a personal trainer now for 8 years.
Cool.
So it's been a while. And then, once I kind of finished my master's in EP, kept a little bit of personal training going, and then fully 4 to 5 years being at EP now, which seems like a long time, but
goes quick.
So
we throw around the term EP all the time in clinic and to people around. I get a lot of questions. Literally everyone I say it to just asks the questions, what is an EP? Everyone obviously has different ways of describing what an EP actually is, but I want to hear it from two EPs. Could you define exercise physiology for us?
Definitely. Or you want to go first? Or?
This is not a test.
Oh no.
You can say anything to me and I believe it, so do whatever.
So I would say it's still allied health, and it's still a medical professional or practitioner, but the point of difference, I guess, from say physio, it's probably easy to compare it to a physio because people know what a physio is it's more active-based rehab. We're not using hands-on treatments, not diagnosing. So that's like the difference in our scope of practice. But working with whether it's chronic conditions or injuries or performance or kids, it's kind of any health condition, but using more of an active-based approach, whether it's movement patterns or strength training or just exercise habits. That's probably what I would compare it with.
Awesome.
Yeah, I'd say definitely agree with Liam with all that. Like the way I see it is like we use exercise as our tool, like it's our medicine to people, to whatever their goals are. We kind of use exercise as the main thing. Now that, like Liam said, like we kind of more work with like more special populations. So you could think maybe more unhealthy pops, so people with injuries, like Liam said, people with chronic health conditions.
So we're talking like the diabetes, the heart conditions, lung conditions.
All of those chronic conditions. Now, it doesn't mean you have to have one of those, but we understand the physiology behind it. We understand the assessments or maybe some contraindications between someone who's had a heart attack. Should they just be going as fast as they can on a bike and pushing themselves to their limits? Probably not. Cool. So we understand all that background knowledge to then provide a safe and effective exercise plan. We use assessments more so to guide, to meet the person where they're at and make sure that, people are exercising effectively. Like we know how powerful exercise is as a tool, but we just help those populations that may struggle with it, because most of the population don't exercise. And one of the biggest reasons for that is because they've got an injury, they've got a chronic health condition. So we can be that link to get them exercising, but understanding their condition and being able to make sure you're doing it safely is probably the big difference. And then obviously, like Liam said, there's difference between physios, there's difference between personal trainers, because you kind of get like put in like, oh, it's kind of like a personal trainer, but like a physio, and you kind of get, people in their appointment like, oh, I'm in my session with my physio or my exercise physio. So you kind of, or my trainer.
Exercise physio, I've heard a lot.
Exercise. Like, so you kind of get put in this bucket. And like, to be fair, there is similarities. Like physios still use exercise as a tool. And I'm sure we're going to go into what's the difference between all of them. But
definitely.
I'd say we're trained and we understand from like the more special populations as well. But we can still work with healthy pops as well.
Yeah. So let's go into that a little bit, the differences between the physio, the chiro, the osteo, and then the EP as well. Because obviously at Movement Therapy, we work with everyone together. What would be, like, I mean, you said it a few times about not being manual therapists and not diagnosing specifically. What would be some other differences between a physio and an EP?
I think you'd probably see an EP patient for longer.
Yeah,
like it's more of a long-term treatment. For some people, it might be for the rest of their life, depending on what they're coming in for. Or it could be someone that is, say, in physio or chiro, osteo after an acute injury or surgery, and then once their, say, movement or mobility is to a level where the physio or the manual therapist is happy, then they might spend a few months or even a year or longer in exercise physiology, retraining movement patterns, and then strengthening, and then progressing, and then discharging. So I'd say probably time frames is a point of difference.
Yeah, I'd say I guess how we assess and treat could actually be very similar, so I can understand the confusion between the two. So Ethan, you being a physio, you're still going to use exercise. So 100%. It's like, well, what's the need for exercise physiologists then? If you can do exercise, then correct me if I'm wrong, but
no, it's exactly right.
University training, like you guys don't really do that much exercise from what I gather, maybe a little bit.
It's really funny, like you touch on that, the stereotype for these four professions. Physio is the exerciser, chiro is the cracker, and osteo is the sort of witch doctor, if you can sort of use that. That's the stereotypes, being employed. So it is the fact that, wouldn't you just go to a physio instead of an EP? What's the actual difference there?
I think for me, it's like you could, because someone off the street comes in, has a sore knee, there's no reason that person can't see an exercise physiologist or a physio. So it's like, what's the big difference? For me, it's like the tools that you have to use. So you guys definitely can use hands-on, you can use needling, you can use massage, you can all do that. But maybe our tools is like, hey, we're going to give you this trigger point ball and we're going to release the same area, but you're just going to do it actively. So we're not putting our hands in anyone. So that's like a big difference. And like Liam says, diagnostic tools is probably another one. But then it kind of goes into for me, there is a crossover. So like the movement-based stuff, maybe you're doing mobility, physios do that as well. And then it kind of goes from like, which we can do mobility stuff as well and release with trigger points. But then it goes into more like training and adaptation. So you think more like strength and conditioning. But again, the physio still needs to understand the strength and conditioning.
Definitely.
But maybe we do a bit more of that. So you might say EPs do more end stage rehab. You might say that a bit more because we focus on getting adaptations in people. So whether they need more cardiovascular conditioning, maybe they need to build muscle or strength. I think that's kind of our strong point.
So it's almost the progression from the manual therapist into long-term stuff, like you said.
Yeah, and then like Liam said, it's a long-term thing because we know these adaptations, they take time, right? So it's not like, hey, I've come to an EP, I want to build strength. Yep, sweet, we're just going to do 2 sessions and you have your strength. It's like, no, this is like a journey along. So we do take people on the journey and then we're trying to get them, we know how powerful exercise is as a tool, so we're trying to get them to do it long-term. And I'd say that's for me probably the bigger difference, but there's so much overlap as well. It can be a little bit grey, but at the end of the day, there's so many people out there that need exercise, so there's no point in arguing over, well, physio does this,
get into someone.
and EP does this. It's like, everyone needs this. Like every single person listening to this needs exercise and should consider exercising because of the benefits of it. Yeah. Whether a physio starts you, then an EP does it, or an EP starts you. I don't know. I don't see it as a conversation of like, we do this, but some people do see it as that.
And then I guess that you probably know a bit more about this one, Luke. A lot of the time people will sort of think as an EP as like a glorified PT in some way, shape, or form,
which we don't.
We don't. It definitely isn't.
You mean I went to university for 4 years?
The Hextet for the personal trainer. Yeah. No. So I guess obviously you've probably both heard it along the way and have probably had to stand up for yourself a little bit. But in your experience, and then also Liam as well, how would you say that you differ from not just a PT, but from a PT in your experience? Yeah,
so like speaking as a PT, and this is the same thing, it's not to say like, PTs aren't good at their job either. It's kind of like, for me, the first thing would be the level of training, I would say is a bit different. So you can generally do a personal training certificate in a couple months and just quickly pump it out, and then you're training people, which is a whole nother conversation in itself.
We could be here all day about the regulations.
Whereas exercise physiologists, as you would have heard at the start, we do 4 years of training. And the level of detail we go into is, which we need to, because we are, like we said, we're working with those special populations. So the main difference for me is, I would say, if it's just easy to understand, is personal trainers may deal with more healthy populations. So I've got no injuries, I've got no health conditions, I just want to train, my GP said it's fine to do, so I'm going to go see a trainer, I just want to get fit, maybe I want to lose a couple kilos, that's generally who a personal trainer will get. Now, there's some trainers out there that maybe think they can rehab injuries, again, another conversation, but for the most part, and as a trainer, you've probably got to understand injuries as well a little bit, so you learn that along the way, but I'll say the difference for me is like the level of training, what we do with our exercise prescription. So we like really assess first and be like, okay, what does the person need? We take in consideration their injury history, medical history, to then get a good plan, because again, exercise can, obviously it's a powerful tool, but if you do too much of it or at a high intensity, it could be detrimental to someone's injury or health. So we understand all that as a background as well. And to be doing both, I find that most people, as exercise physiology gets more popular, they're starting to go, I actually like seeing EP because everyone has a little niggle or something that they've got. I mean, they've got a bad experience with a trainer. Where the trainer's just like, they just push them, adaptation, get stronger, get fitter, and then things can go wrong, obviously. So people are starting to trend to more that as we get more popular as a profession as well. So that's probably the main difference. Like, trainer, just get you fit, get you strong. We have to consider so many other factors in that, and there's a lot of the population out there that need that consideration.
Definitely. There's obviously that crossover from...
I don't need to add anything to
that. I think that's a really big thing in the 4 years of training, like a university degree. You've had a really high level of training to be in this role now. It's not just a course you can do or something you can add on that you do off the internet, pretty much.
So there's definitely heaps of crossover between that, like all of the professions. There's that little bit of crossover. From our point of view, what does an appointment sort of look like from an initial perspective of a client? We'll go through some specifics later, but generally as a one-on-one appointment, what would you expect from a client coming to see you boys one-on-one?
Yeah, it depends on where they're at, but I guess say someone that's in the middle part of their treatment. They'd come in and you'd probably ask them how they've gone with the stuff you gave them in the last session, whether that was specific exercises or recommendations for training or whatever things you gave them from the last session. Ask how they're going, ask if they've got an injury or a niggle or whatever their condition is, how that's going. And then it's probably, I think I tend to do a lot of look at what they've been doing at home and see if it's been okay, like how well they've performed it.
And stuff.
And then progress it if they need to, or add in new things or take out other things. But it really depends on the patient, whether they are someone that is coming in for specific exercises for a specific injury, or if they're coming in for education on how to exercise, not mattering on what kind of exercise they're doing.
Sure.
Yeah, I think like Liam said, it really depends on what they're after. So that's kind of, the session depends on like, is it the first session that we've ever seen them? If it's the first session we've seen them, we've got to find out where they at, what their goals are, what they want to work towards, and that will kind of then guide our future sessions.
Sure.
For some people, it could be coming in like they've had chronic pain for years, and it could just be, getting some gentle movement in, some lower aerobic work, and then maybe there's someone else that's going back to sport and they're up to hopping and jumping. So again, Liam's exactly right. It's where the person is at, and then in that session we might be like assessing to say, okay, we gave this exercise for your knee. Let's see how your body's responding. We're going to recheck that knee. Oh yeah, it's moving better. That's good. We're clearing some things. We might feel like, all right, I think you are ready for the next stage. Let's do some tests. Yep, you are. Okay, let's change your program up. So it's like a journey, and that journey is getting them from where they're at, like Liam said, and then where their goal is. And we just kind of like plug in like each little step. It might be some range of motion, some mobility, then it might be some more strength stuff, depending on what they need as well. And that's where you have to understand what you're assessing to then work out what you're actually doing in that session, rather than just saying, all right, we're going to come in and do an exercise program. It's very individualized, which probably goes back to the whole personal training thing. You could just do a session, whatever, but with EP, it's like individualized to what the person is after and their history as well, and their goals.
So I guess as well with a lot of client expectation is you get the whole, the theory that PT is the one in the gym pushing people and more reps, more sets and that sort of stuff. But your actual appointments in here, there's similar structure to a manual therapist or a physio, chiro, osteo, where we assess, we treat, and then we give them, the patients the exercise that they need in order for their sort of goal and, like you said, their stages of their rehab. Do you then provide the program as well, and do you run through programs with the client in session as well once you have those goals set?
Yeah, so generally the big thing for me, I know Liam's the same, seeing him treat, is like, there's one thing to go, here's your exercise plan, and it's another thing to go, this is how you implement the plan. Because we see a lot of people come in and they're like, they've got injuries, so they're going to potentially find ways around in their squatting, and they're shifting to one side because they've got a left knee injury, now they're shifting to the right. So it's our job to look at that and go, okay, what's actually going on here? And then, again, prescribe the right intervention for that. I think that's like a big part of our sessions as well.
I think patient to patient it'll depend. Some patients or some sessions you could just be focusing on one or two exercises for the whole session. Others you're recapping 4 or 5 you might have done over the last 2 or 3 weeks and structuring it. Some sessions are doing a program, whether it's an hour-long appointment.
True.
It can really depend patient to patient, but I would say, difference to a PT is we're probably not doing as much exercising with the patient with us as making sure they're doing it well here and then trying to get them to complete it or perform.
So when you say, you spend time doing 1 or 2 exercises, is that more just correcting their technique, or figuring out whether it's the right exercise for them?
It's like the quality and how, we could do a movement with someone and it's just not working for their body. So we go, okay, let's try something else. You could just be trying to get one thing, just say you're trying to get someone's hip moving because they keep getting low back pain when they're doing deadlifts or something. Can you try different movements? That one didn't work, and then they did, and like, oh, the quality looks better, the patient felt it a lot better. And that could take 15, 20 minutes. And then, all right, you do that exercise, then you reassess from this. And that could be a session. You could have done 4 moves, but you prescribe 1 exercise. It's a lot of trial and error to see, because everyone's body is different, right? So it could be, and then some sessions it could be maybe 4 or 5 sessions in, it's like, okay, they're getting the movements, they're understanding how all the parts work together, and now we're doing like bigger movement patterns. So it's like you get more done because they understand like the little parts of the movement that you spent so long on at the start. So I think like Liam said, it just depends on the person that you have in the session, but it ranges from all right, we're pushing someone hard, someone's jumping, they're running, they're lifting heavy weights, versus we just did two little movements on the floor.
Completely different.
It's completely different. And I think that's the thing when people say exercise, they think like fast as you can, sweating, burning, but that's not what an exercise physiology session looks like.
Awesome.
Because we are, again, working with different populations, we just got to meet the person where they're at as well.
Yeah. What are some of the challenges? What are some of the barriers for EP that you've experienced over the years, if any?
I think something that is tricky is patients that say are in pain or are really struggling with something. It can sometimes take longer to yield an adaptation that then they get buy-in from, or they feel like they've made progress with.
Sure.
Because it is, say, like muscle adaptation or bone adaptation that can take longer, whereas sometimes I wish I could just stick my hand in and make it feel better.
Here's a tablet, make it feel better.
Yeah.
So that's the client expectation.
That could be that's the challenge sometimes. But yeah, if you outline like expectations and realistic timeframes, then it helps a lot. Otherwise, none really.
Yeah. Awesome.
Yeah, I think that's the challenge for me as well. Is like some of the stuff we do takes time. So if they've got to develop strength, and they're like the expectation is going to be a quick thing. Like obviously we're trying to address that in our sessions and say, this is how long it takes for muscle to adapt. This is how long it takes bone to adapt. We have to address all those things. But it's definitely a challenge for some people. Like exercising isn't an easy thing, and people sometimes rely on more passive modalities. Like you couldn't just go and like go to a gym and train for 3 hours, but you could probably sit on a table and let someone massage you for 3 hours.
Sounds great.
So like sometimes people go towards these more passive modalities. In the short term, it feels better, but sometimes the challenge is you need to say to someone like, hey, like you've been doing this for years now. You've been going to get a massage, and like you need to put the effort in with this, and people just haven't done that. And the thing with us is like, I say this to my patients all the time. I can't put my hands on you. This is the partnership. So if I'm trying to give everything I can and you're not, this is going to be a bit of a challenge because I actually can't do it for you. I can prescribe the perfect program, the perfect plan, but if you're not doing it,
do it.
I actually can't help you. You know what I mean? So, and I like that about the job. It's like there's an accountability to the person that you have to do the work here if you want to get better. And I think I like that about the job, but it is a challenge as well that I'm giving everything I can, but the other person's not. And that's when we just have to say, look, maybe it's not a good time or whatever that may be. They just go back and get their massage, but they have to keep doing that for
years and years.
A long time.
That's obviously the barrier to client expectation is the plan and knowing how long it will actually take and why it's actually taking that long. But then the quick fix to be like, you're right, it's not, I can't give you one exercise and this is going to fix this. And you coming in to see me once a week for half an hour is not going to fix this. You need to fix this. It's you guys giving the patients the tools in order for them to kind of do it themselves. And if they want to, awesome. But it's the expectation, I guess, of them knowing that it's going to be a long-term plan.
And also just them sticking it out long enough to feel the benefit.
Exactly.
Like how long do people start exercising and they're like, oh, I'm so sore, like, oh, my muscle, and like that, unfortunately, that happens at the start. But it's like, why would anyone do this? I can't even sit on the toilet. Like what? Like, so it is.
But how many people have started running and said, I can't run my 10K yet, why is that? My marathon's under 3 hours.
We all know, like, we all exercise and we know how good it feels when you're exercising regularly, and then as soon as you stop for whatever reason, you're like, oh, I wish I could go back to training because you feel great. Like, there's all these physical adaptations that we get, but just mentally you feel so much better as well.
100%.
So I think like if people can get over that hurdle and then get really consistent with it, they go, oh, okay, I probably should have been doing this sooner.
Yeah, 100%.
I guess on the flip side to the challenges, what have been your favourite things about being an EP so far?
Long
course.
We can cut that out.
I really enjoy how it's like, say, an 8-hour day or a 10-hour day or whatever, how long the day is, but you've got 10 different people you see, so it's mixed up a lot throughout the day. It's not the same doing the same task for a 2 or 3 week period. It's very different. Each person, each case is quite different.
Yeah.
You might see 3 or 4 knees in one day, but they're not all
They're
the
all
same.
still different, yeah.
That's probably one of the things I enjoy the most about it. Socialising with people, being active relatively.
I think I get very jealous. Obviously, we stay a lot in our rooms a lot of the time as clinicians, as hands-on therapists. We try and come out to the gym, but seeing you guys in the gym kind of all day is cool. I don't know if you guys.
It's a great office.
Yeah, it's a good little playground for you.
Yeah. I'm the same. Like Liam said, I love how it's like every patient is so different. Like it keeps you interested, engaged. Like if you're just kind of like, again, probably shouldn't go back to the personal training thing. People are going to think I hate personal trainers. But
you are a personal trainer.
I still love a personal trainer as well. But like if you're just kind of sitting there, arms crossed, and just watching someone exercise, like it can get boring after a while. So,
and I think that's just to interrupt. That is the stereotype of a personal trainer.
Yeah.
And I've seen it in other gyms. People have told me is that their trainer is sitting on their phone in the corner because they've given them the program and they're letting the patient do the program. And the client is spending $150 a week on this personal trainer.
Yeah.
Like that's what really boils my blood is just that interaction with the client.
Yeah, now like there's probably exercise physiologists out there that are like
that
as well, and there's probably
physios out there.
So it's like this is like, but like just generally, it's like you really have to be engaged in the process of like, okay, this person's here. How do I get them to the next step? And like, oh, this come up. Okay, well, how am I going to get around this? So there's that problem solving aspect that I think is good. And then obviously like the reason why I do it is just like just getting people to their goals and the feeling that you get like when someone comes in and like they said, I've got back to doing this, or you know, someone's been in pain and they're in tears because they're out of pain and they never thought they would be out of pain. Like stuff like that is amazing, why I do it. And like, at the end of the day, like I would not change being an exercise physiologist to a physio because I know how powerful exercise is. Yeah. And for me, it's like a no-brainer. Like everyone needs to be doing this. If you can get someone who's never exercising and getting the benefits of it, like it's unbelievable. I reckon. So that's very rewarding for me.
Yeah, so good. Do you guys have a specific example of clients you've actually taken through different sort of processes currently that you're actually treating or treated in the past?
Yeah, I've had a few. Like, it's interesting when people come into it. Like sometimes they can come in off the street and see an EP, or maybe they might come from a physio. So everyone's kind of got like a different journey. But one example, which just recently, one of our patients has been discharged from shared appointments, and they kind of started with like a injury. I don't know if we can name names or.
Probably don't.
No, okay.
Unless you've asked the patient.
Yeah, I haven't asked. Client X had like just had like an injury where they required surgery.
What was the injury?
Ankle injury.
Mm-hmm.
So obviously I'm not going to give out all little details, but initially after the surgery, which you would expect, the joint would be pretty stiff. Needed some hands-on treatment. So that's like an example of like where that would be very useful. Maybe getting into exercise straight away isn't the best option. So hands-on treatment with a physio.
So this client came through the physio through us? Perfect.
So, in the clinic, got hands-on treatment, got to a point where the client restored some range of motion, was kind of getting a little bit of strength back, and then once though at that point transferred to exercise physiology, did a lot of one-on-one sessions, building up strength, coordination, balance again, just even cardiovascular fitness. So we got to a point where we were like, everything was feeling good, feeling strong, we increased in our capacity, could walk further. And then we kind of transitioned from one-on-one exercise physiology to shared appointments. So then the patient had a pretty decent period of time doing shared appointments. So shared appointments are just an appointment where there's multiple people in that appointment. They're sharing the one appointment time. For us EPs, it's actually a bit more work because you have 6 or 7 people in one appointment. Once, so you're trying to, everyone's in their appointment. You're not going to leave someone, you're not going to see someone in an appointment. You're not going to go into an appointment and just go, oh, I'm just going to go see someone else. So you're constantly back and forth. But it's a good way for us to see how people are doing their exercises, they're training, they're pushing hard, and we can kind of watch everyone. So she kind of got to a point where she was training hard, pushing, ankle got really strong again, back doing all her goals. So she was back walking long distances, which was a struggle post-injury, being able to go back to things like pickleball, and then we discharged her, and now she's looking at getting back into the gym environment as well. So that was a pretty cool story. How
long did it take? What was the timeline?
Oh, it's pretty decent. So, because she was in shared appointments for a bit, probably like
over a year.
Yeah, definitely over a year. Awesome. So, but like the way I see it is like, it's over a year, but that period of time that she's invested, now she has the tools and resources to go and keep doing this forever. So that's like, for me, it's a no-brainer. It's a great investment.
And as a percentage of your life, a year is not a lot of
to
time.
Learn how to exercise, move your body, what you should be doing in the gym. 100%. I personally think it's a great investment as well. So.
Yeah. You got one?
Yeah, I've got one similar to Luke, but was a direct referral from the GP.
Cool.
So a care plan for this patient. It was without going into it too much, it was a mental health care plan, so not a physical injury as such.
Awesome.
And we had 2 sessions, wrote a program to try get them exercising straight away and then straight into shared appointments.
So they didn't come with an injury, obviously they didn't come necessarily with any musculoskeletal pain.
No,
Awesome. Yeah.
So it depended on their presentation for the first appointment. If there was significant like mobility restrictions or pain or lots of medical health history things, then it would have taken longer to get to shared appointments. But because the person had relatively no injuries, they moved relatively well, we were able to do a basic but specific program for them and then get them straight into shared appointments. And they're still training in the shared appointments now.
Awesome.
That's ongoing, but their goals was to be able to then feel confident to go train in a gym by themselves.
Really cool.
So we kind of are using it as a halfway between not knowing how to train to then going to train without someone being there. So that's an ongoing one, but that's been a good one where the GP wrote a referral, get them going.
That's a perfect example because there's no injury present. It's not even after an injury. It's just it's an active goal for a client with different
someone
goals.
Not exercising.
Yeah, exactly. Really, really cool. So we obviously talked about, I mean, those 2 patient examples are a really good split of what people might expect EPs to do and then completely left field, have no idea. Is there a perfect client that you guys have?
Someone that does their exercises.
That's it.
I think that's literally across the board. That is it, everyone. That wraps up the podcast.
Because it doesn't even need to be someone that's essentially getting better or gets better straight away. Like, if someone's doing their exercises, regardless if they've gotten better or not, it's something to work from. And eventually they will get better. But compliance is a pretty big thing. But then, like, you just like working with people that want to be there.
Was it more so? Sorry, I cut you off halfway through your question.
No, that's good. That's all I needed.
I'm probably never going to get another appearance on the podcast.
Oh no, you're done. We'll follow this.
Do you mean like certain populations, or do you mean like
either or? Like, if you were to say, hey, Luke, you get your choice of client, what would be it could be age, it could be condition, it could be goal. Like, who is the one that you're more motivated to actually? Not that you're not motivated for everyone, but what's the ones you get really excited by?
I think even just like what you finished with there, someone who is motivated and has a goal. Like that's the big thing for me. It doesn't matter if they're young or old or male. It doesn't really matter as long as they've got something they want to work towards. I think. Whether they just want to be able to, lift up the grandkids or go back and play a high level of sport and be running and jumping. I like all those people because it's the same feeling, satisfying when you get them to their goal. I think, people who have a goal is the people I like working with. And, motivated to get there. Like, there's people that come in and go like, you know what, I'm willing to give this a shot. And like, as soon as I hear that, like, we're going to have challenges along the way. But as long as we got something, and that's part of our job as well to work out what the goal is. But, it keeps it interesting working with different populations anyway. So it's I'm not, there's obviously physios and EPs out there, like I'm the knee physio, I'm the shoulder, and that's all fine. But I actually like working with a wide range of people.
And I think like further to what Luke said, in the sense of sometimes patients might come in, they don't have a goal or a good goal. They just want to get strong or fit. But they don't know why, or they've just been told to come in.
Get fit.
But then it's partly our responsibility to get a meaningful goal, and then that can be the change from them just coming because they've been told to come to wanting to be here to get an achievement for some description. So sometimes you can have a patient who might not be as motivated, who then after a couple of sessions becomes the ideal patient.
Which is rewarding in itself. Right?
Absolutely. And coming in, do you need to be pain-free to come and see you guys? I know we briefly sort of touched on it, but is that something that you look for from people coming in off the street or being referred by their GP? Are you looking at, they have to be pain-free or they have to have some form of...
I'd say the majority of people we see still are in pain.
Awesome.
I think beliefs around their pain is an important part of that. It's not just always like they've got a sore knee, like maybe it's something else happening.
Yep.
But no, definitely we see people with pain probably more often than not. Different challenges with people in pain, obviously, but there's no reason why exercise can't be a tool to help regulate or mitigate pain.
Yep.
Yeah, I'd say we actually probably see people who are in quite a bit of pain. Like it's those people that, you know, if you roll your ankle, there's like it's going to take this amount of weeks, then you're probably going to be out of pain, then you're going to be back to doing these things again. It's sometimes just the people that are in chronic pain that we're trying to work on. They've been in pain for years, and now we have to deal with that and then getting them exercise. And their body's quite sensitive to doing things, so they might do a little bit too much, and now their pain's flared up as well. So
100%.
I'd say for the most part, like Liam said, we work with people with a lot of pain, and we have to have the tools to manage that and get them exercising. Because just because you're in pain, we don't want you not exercise as well, because then there's an effect on you not exercising.
Absolutely.
You decline, your fitness goes down, your capacity goes down, all that. So yeah, people in pain. But then there's people that we get to a point where maybe they were seeing a physio and they're not in pain anymore, and now they're actually just ready to train and jump and run and all that. So yeah, you get like a wide range of people, but pain or not, we can still work out what's going to be best for the person and their goal as well.
And I guess you just touched on someone who's come to see you from a physio. What would be an instance where one of you would actually, you know, the referral pathway would be the other way, and you would refer someone to a physio instead of seeing you, or is there any reason you would?
Good question.
We, I guess in the shared appointments that can happen, in the sense of, say if someone's training in the shared appointments with exercise physiology, and then they might over the weekend fall down the stairs, or they're back at sport and they hurt themselves, that might be a refer back to manual therapy for checking that nothing serious has happened.
The diagnosis.
Yeah, diagnosis. Or it could be a patient that you're treating and something's just not getting better, it's not going away, whether that's a compliance thing again, or whether that's not great exercise selection. It could be both reasons, but someone that you just can't get any progress or adaptation with, that could be then a referral back to see if they pick up something different, or if they have different treatment modalities which might be a bit more aggressive, for lack of a better term, where they can yield a bigger adaptation. That would be where I would think to refer back to manual therapy or across to manual therapy.
Yeah, I think Liam's nailed it. Like, I won't point out too much, but like the person in shared appointments, when we're exercising people, there is, if you've had an injury before, there's a chance that if you're pushing hard, there could be like a aggravation or re-injury and stuff. And we have tools to assess and go, is this person actually going to need to go back to physio? Sometimes it's like, I just need a bit of a release work. Like, we tried this, just didn't get what we were after. We reassessed it, didn't really change it. Maybe they need some hands-on treatment just to kind of further release. And the physio might go, sweet, I've done 2 sessions with them, straight back to you guys. Cool. So it's like, you work together as a team to work out. And there's no like, Liam and I are like, oh no, you got to stay in EP. We have the person in front of us.
Hold on to you.
And we understand the tools you use. Although we can't do them, we might think, actually, maybe another tool could be the best thing for the person right now. And that's when we'll go, okay, let's refer them back into a manual therapist.
So that's referring from when a client is already with you guys, and then identifying, you know, I need someone else to look at this from a diagnostic point of view, potentially, to make sure that they're still safe to exercise. What would be your advice for someone, say they are in pain? You know, we could use 2 examples here, one of the acute rolled ankle versus the, 10-year plus history of chronic back pain. What would be your advice in terms of if someone came to you and asked, who do I see? Do I see you as an EP, or do I go and see the physio? Do you have any specific sort of advice you would give?
Physiologist,
straight away. Done. I don't even know why we work with this. It's now just an exercise physiology class.
I think it probably is easier to answer if it's someone that you know. Like if you know the patient, sometimes you can try to educate or sort of say like, you might not get the short-term relief, essentially, if you stay with exercise physiology, but we're trying to fix or retrain what's causing the issue. So like, it's kind of like an analogy, like if you walk past a door that's got a nail sticking out and you scratch your arm, if you just keep putting a Band-Aid on, it's not going to fix anything. Like you need to take the nail out of the wall.
Yeah, you keep walking through it, you're going to keep getting scratched.
So it's like, it just depends on the patient. That patient might need hands-on,
Yeah.
or that they might be someone that sort of, I guess, understands or is willing to sort of persevere with exercise for a few more weeks, and then they might get that relief or they might get that change.
Because you said again, it was always for the long term for the EP. It was that more of a find the problem, fix the problem, not just put your band-aid on the cut. It's the get rid of the nail, get rid of the cause of the problem first, which might take months.
Yes.
But if they can persevere with that.
Yeah, I don't know. My answer would be a little bit different. Not that like that's. I'd agree with Liam as well.
No, it's good.
But like,
Just start fighting, guys. Come on.
I disagree. No, no, but in terms of just like, if they come into just say our clinic, I think it shouldn't really matter. So
Good, I like that one. That's
good.
good.
The ankle,
That's correct.
the ankle example or the low back pain.
Yep.
A good physio should be able to help both,
Yep.
and a good EP should be able to help both people. Which then maybe makes it a bit more confusing for
The patient.
The patient, because like, who do I see? It's like, if you come in with a problem and either the physio or the EP provides you a solution and then gives you the solution, you probably don't really care if they're a physio or an EP or a chiro or an osteo. It's like, that person helped me.
And you probably don't even know what they are. That's
it's
the benefit
like,
of that.
And I think that's kind of what we've done at Movement Therapy. We're movement therapists.
Yep.
Like we like whoever you see, you will be in good hands. And if just say you do see an EP and we go, look, we've assessed you, we've done all this, I actually think Ethan, or I think this person is going to be better, we will do that.
Yep.
So if you come into the clinic, my answer would be like, now there is some situations I should say that maybe you'd be more inclined to see someone like super post-surgery, for example. I'd go, hey, that's a more obvious one. Go get some hands-on treatment. You'll need that for a couple of weeks. But yeah, in that example you gave, I'd kind of go, I actually think both could do it.
Yeah, it's a really good answer.
But there is a couple small situations where maybe hands-on would be the best option.
Yeah, I think that's a really good answer, obviously.
But I think a good thing about movement therapy as well is both is there available to you. So if someone was to come in and see you and you thought it might be better for them to go see a physiotherapist instead, or vice versa, it's a good thing that you don't have to go somewhere else. It's all in the same spot. Or if you're there with someone and Ethan's not doing anything, he can always come down and have a look as well. So,
or maybe they shouldn't be in this clinic, and then we've got to go. Actually, you shouldn't see an EP or a physio. You need to go
get to the hospital.
You need to go see the GP, or you need to go to the hospital. Like, and that's a skill and training thing as well. But it's a tricky question to answer. Right?
It is. It's an impossible question. So you've done really well with it. Good job. It's so client to client, different obviously from each person and each experience. But I think the main thing there, like Zoe said, is that we have everyone that you kind of need for that journey. If you don't have a pathological problem that you need to be in a hospital for. We've got everything that you kind of need, and then we work really closely together. So we do co-treat, and we do some appointments together, and we're constantly communicating between patients. So a lot of the time, patients really have no idea if you're an EP, if you're a physio, if you're a chiro, because we're just so closely linked. That I think is really good. We're all movement therapists at the end. All we want to do is make our clients move better. That's kind of it. It doesn't matter who it is. Really cool. Now I know we've spoken about shared appointments for a couple of sessions. I want to sort of break them down a little bit. You mentioned sort of what they were a little bit, Luke, last session when we talked about, but I want to get into them a bit more specifically. So they're obviously a shared appointment, so 5 or 6 people coming into the same appointment. How are they sort of run? What is the structure of a shared appointment, and why do we have them?
So it's run by an EP.
Yep.
Or actually, it's about to be physios.
Yeah, there's a couple of physios coming in there. That's good. So it doesn't matter.
Doesn't matter. No, but they're small group training. I guess you could call them, but it's much more specific than everyone doing the same exercises.
Yeah.
Or like it's not like a not yet. It's not like a specific Parkinson's training or balance training.
Yeah.
There could be 6 people in there at completely different ages. Goals, abilities, but they're essentially like 6 one-on-one sessions where people are able to train semi-independently. They still might need some coaching, cueing technique, but they're designed for people to get more frequency and more value. They can train more often. So it means that we could see someone 5 times in a week rather than seeing them once. So we can progress them much quicker. we can use it to train people as like a strength and conditioning tool. That's what I would describe.
Nailed it.
Awesome. Yeah, perfect. I think the value is an interesting one we talk about. I think cost is a massive barrier
for sure
for people. How do we do that in shared appointments? What's the sort of cost value? How does that work?
So the cost of one appointment, you pay that same price, but you get unlimited appointments in the week. We have some in the morning, some in the evening. So you can come to as many appointments as you like.
Great.
So you get more value for the same price. So that's what's going to be very beneficial, because you get more touch points with someone who's watching you do your exercise. One of the biggest barriers to people getting better is when they're doing their exercise program, they're not executing it well. But then you've got eyes on you to go, okay, hey, I just need you to do this, this, and this little tweak. They understand what you're talking about because you've had one-on-ones with them before. Then you go to the next person, hey, now I want you to focus on that and that. And then you kind of come back, and then so you're getting constant exposure for the exact same price as you would in half an hour. So multiple times a week. So you're gonna get to your goal a lot quicker. You're not gonna get frustrated that in the clinic I can do it well with Luke or Liam watching me, but as soon as I go home, it just doesn't feel the same. It's so annoying. So you have that guidance from someone who can just see the movement. And I know myself when I'm training, I wish someone could help me just wear my body, because when it's your own body, it's hard to kind of know where you are in space and stuff. So you definitely get more value. Then you're part of a community that you might see someone else doing an exercise that you wanted to do. Then you might ask a question being like, oh, how did you do that? And then people are talking and they're working out oh yeah, I did this. And then so you're learning from other people as well. So and then it's a fun social environment as well. So there's so much more value for what you'd pay for half an hour with one of us. So I think it's personally great value.
The community thing's a really big. I know sitting on the desk and everyone comes in and they all catch up every night, and it's nice to see that they're progressing towards their goals together. But then you also get that community of people that you come and see every day or every couple of days, and you do your exercises together. I think it's a really good tool. How would you say it's different to a normal gym class, for example?
Probably back to that individualized programming. Each person's may have similar exercises. Some people might be doing the same exercise, but could be for completely different reasons. But it's different to a normal gym class in the sense of we're not doing a whole lot of cheerleading. In the sense of you want to see,
let's go, faster guys.
Again, people think they're just yelling at them, just going more reps, let's go.
You need to work harder, burn more calories.
There's probably a time and a place for that for some people, but in here it's probably not the same time or place. We're more specifically, like I said, it's 6 one-on-ones. You're with someone for a couple minutes and you fix up whatever they're doing, and then you move on to the next person, rather than watching everyone from the front or the back and maybe yelling out one thing to one person, but then just cheerleading.
And that's not to say that we're not making it challenging. And if anyone in shared appointments is listening to this, they know that we love to make it challenging. So if someone's doing an exercise and we can make a little tweak to go, okay, now you're feeling that, oh my God, my quad is on fire. What have you done kind of thing. So I think it's different to just saying you're kind of there as a, push harder, clap, let's go. Motivator versus we're actually breaking down movements. Okay, what do we need from this movement? We need this and this. Oh yeah, I can feel that. My leg is on fire. So we are pushing people as well. It's not like we're not pushing people. We're doing it in the right ways, and we're understanding that maybe that person with the injury, we're going to push them, but we can't push hard on this exercise, or maybe we can push hard. You know what I mean? So it's it's not like we're not pushing them hard. It's just very different between being the motivator, the let's go versus this is what you need. You're still focused, you're still doing all that, but. I'd say that's probably the big difference.
Yeah, that's really, I think, seeing the shared appointments in the clinic, and it's often times where the gym is just pumping. There's a really good vibe around it. Everyone's just really happy lifting heavy weights. When you go to a gym, everyone's in their own little world, and it's a very it's an intimidating environment. Everyone's on their phones, and you don't see that here. Everyone's quite happy, and they're still working hard, you can tell, but they're actually they seem to be really pleased. They've all got their goals, they've all got their programs, and then obviously the EP's walking around and dealing with everyone individually, which is I think is really cool. It's a really good benefit from a shared appointment. Cool. So I think that's a really good overview of what an EP actually is, guys. So really appreciate your time. Thanks Liam, thanks Luke for
guys.
coming down, spending your Friday afternoons with us down at the Movement Therapy Podcast. So yeah, I think next week we're actually going to go into physio versus chiro.
That'll be a
which
good
is going to be an interesting, somewhat controversial topic.
What chiro are you getting on?
We're going to get big Andrew Darthwest.
Oh!
Yeah, it's going to be a big day. So yeah, thanks for tuning in, guys. As always, please like us all on our social media accounts. We've got Spotify, Apple Podcasts as well. Follow us to keep up to date with all the stuff we're sort of doing in the clinic, and then follow these guys on the shared appointments as well. Thanks, guys.